We're so honored to have Master Chris Leong with us this morning. He is, of course, the bone setting specialist utilizing TCM method or his very own Chris Leong method of Theta. Good morning, Master Chris.
Good morning, Bel, and good morning, JD.
Morning. I'm so excited.
Yeah. So honored for us to be able to speak to you this morning. Now, first of all, Chris, how different is your method compared to other people's method in Theta?
The Tita, actually, Tita, a lot of people say, hey, I see the Tita and you is a bit different. Actually, yes. From a very traditional, the Tita, they are using what I call the ointment, they are rubbing, and then the rubbing and do a manipulation, maybe a 2 or 3 people to handle one patient. Or like the example, like dislocation, one person using the grabbing the patient, another one is pulling. So then slowly for me, because I go through from a generation of the Theta, then I further study in China, and then the short course in China also. Then I slowly combine it and make it simplified and less on the rubbing and more on the manipulations.
Oh, okay. But what got you interested in practicing Theta in the first place? Was there like a particular incident or maybe an event that led you to want to become Master Chris Leong, the Theta specialist?
Wow, this one I still remember because it's from generation from my dad to my mom, and then my house is what I call is a lion dance, martial arts, and also the Theta house or association, same like a new age of Wong Fei Hong.
Wow.
So Wong Fei Hong. So a lot of whatever customer comes during. Then I still remember my mom asked me, hey, Kong Zai, my nickname, Kong Zai, can you help me to rubbing for this pawpaw, got a rheumatism leg or what? So I do a rubbing. Then
At what age was this?
7 years old.
Oh my God, what? Okay.
Yeah, because I like to follow my father's doing all the martial arts and mom helping healing hands. So my mom treat other patients. Then asked me to rub for this. I still remember this old lady about we call it a grandmom, come over here and walk with the stick and the son carry like this. Wow, so painful. And then I rub, done already. Then after that, then he manja me one thing. Wow, you're so good, wow, you're so young, wow, you are really good. After that, then wow, now Papa can walk without stick. Yeah, you have to learn this to help more people, So Papa cannot sleep every day cry. Wow, you got magic hand. A lot of people, wow, so happy, From that moment. Then after that, the Papa give the money to me, pass it to my mom. So after the time is 25 ringgit. I still remember 25 ringgit. Then I pass it to my mom. My mom say, never mind. At the end, I didn't do I do nothing. So everything you do yourself. So this 25 ringgit you can earn by yourself. Wow, the time I said, wow, 25 ringgit for my 7 years old. Wow, it's a lot. So the time I want to buy the mechanic pencil, I still remember. One mechanic pencil is 2 ringgit and 50 cents. Actually, I want to buy one. Then from that moment, I can buy 10. Then I learned one thing is I love this art. It's called I can help the peoples. And somewhere I got the extra money. I buy 10 for the mechanic pencil. I keep 2 mechanic pencil and 8 I give to my friends.
Wow.
So at the same time, I really understand can share the wealth and share the knowledge to other peoples and also helping peoples.
But at 7 years old, you already knew the right techniques. It wasn't just simply rubbing, right?
That time I very good in rubbing only. Because not in the manipulation, my hand so small at the time. So my mother asked me, because I usually for the papa grandmother, always got the rheumatism pain. So before that, it was so painful. Then after that, after rub, then my mom put the medicine on it. After that, can walk without stick. And then papa said, bye, the eyes, you can see the facial. Wow, so loving. Wow, you are the man. So from the moment,
you have the strength. You have enough strength at 7
years
old to be able to help the papa?
Yes, because I started what I call martial art during the foundation of the what I call the martial arts, the Hostan, and then on the 5 years old to 7 years old. So I still remember within that time, 5 to 7, I'm very active in a shopping mall performance during Chinese New Year, during line dance. So at the same time, I got the strength built up from the martial arts.
Actually, Master Chris, if you don't mind me asking, I've always wondered about this. Theta, what does it really mean? Because if you really translate it, it just literally means fall hit.
Yeah.
Right?
So yeah. So actually this word is not like about invented by me or what. It's about year 2000 years already got. That's why Tita in Hong Kong, Hong Kong or in Hong Kong or in Singapore is a very common. Anything you got an injury, look for Tita. So the Tita is I also don't know how come up with this name. They are called fall and hit.
Yeah.
That's all I mean. But a lot of people thought Tita is thought I was doing the safe deposit box, means I put all the money inside. I said we are not
metal, right?
Tita.
Right.
So can you fix my safe box in my house? I cannot. I only do on the human bone only.
Oh my god, that's funny. All right.
But what are some of the qualifications that you would need to become a Theta sifu like yourself? Like you said, you come from a family of Theta,
Yes.
So you sort of picked it up from your parents, your grandparents, and all that. But you went to school also?
Yeah, I went to actually the Theta is from a generation from my mom and my dad. So my father and my mom follow the master from what I call from China. So the China we call it the Red Army. Last time Red Army.
Oh yeah.
They have the head of physician in the army. So my mother follow one, and then my father follow one. So after I combine the art, then after until me, I still got a lot of curiosity, and then why have to do like this? So I understand the what I call the anatomy, but don't know how the manipulation will be fall back to the position. So after that, I go further study in Beijing during 1990 in Beijing. So from that moment, you call it orthopedic in China. So after that, you saw short course about 3 months over there. Then I further study in Anhui and Guangxi. So I qualification from China and also from generations.
Wow.
So usually for this, what I call it, for my mom and dad, it's not a qualification from what I call from university, but it's from the lineage from the pass on.
Like a mentorship like that lah.
Yeah, that's right.
So
exactly.
most Theta just have mentors, right? Like older generation that will pass it on to them. But
That's
you
right.
have the qualification to back it up.
Yep.
Okay. But people go see Theta most of the time if they like sprain their legs lah, arms lah, neck lah. What other illnesses or ailments can you treat?
Okay. The last time I still remember, every time all the patient come to my mom house, the house. So they are treat usually like dislocation, and then what I call fractures, broken bones, or car accident.
Broken bones
injury.
also you can fix.
Yes. We are specialized on a broken bone dislocation. All this. Then slowly. Then after that, I still remember on the age of about 20 over. So got one patient come and treat. Wow, got neck problem. Click. Then after that, he's surrounded the friends. Say, "Hey, yo, wow, so good. I hear the sound. Actually, I have no problem. Can I do?" So I got a big curiosity. Yeah. Why only got people got problem only can do the treatment? How about no problem can align? Then slowly I come up with one package, what I call one method, and the package is called it body alignment. So after that, everyone is acceptable. Means last time Tita, I no problem why I want to go there. Yeah. So means after that, now it's a call like what I call align back the body structure. Same like a car. No need to send your workshop. It's like balancing.
Like you look like you don't have a problem, but actually everybody needs to have some tuning, right?
Yes, especially now after the year 2000, the Y2K. Oh man, that's why I'm suddenly famous because of after Y2K. My mom time is always got lower back. My mom times all the patients got lower back or knee problem like this. But until my era, year 2000 onward, you can see many of them is a called neck problem and shoulder. It's due to after the handphone come up, the smartphone come up, and what I call computers. They are because of neck affect so many problems. Example like a migraine, headache, hand numbness, chest pain, and also shoulder pain uncomfortable.
Right.
Before we actually started this interview, you actually shared a very interesting story with us. You said you've been viral for how many years now?
4 years, yeah. Actually, yesterday is 26th of November 2016. After because my Facebook come come out the what I call
The
year.
anniversary.
The memory,
the anniversary.
right?
Then I
Yeah.
see, this is a little girl. So because of this, a little girl, the army daughter got a daughter about 40 or 15 years old. He fall down and dislocation the arm and fractures on the collarbone and also the hairline crack on the shoulder blade. So while crying, and then taking a video, then someone is sharing the video out. Then that moment, the thank you for Sikap Kali. Share this wonderful video, and then he blast out because he got a lot of followers. Wow, blast out within a day. I received so many calls. I remember the time. Then tomorrow is a holiday. Then day after is open. Wow, I received so many calls. Usually a call is a Chinese. Why got a lot of Malay people call in and say itu. So I said, wow. Then I tell all my staff, Monday should be a lot of people come. Quite a number inquiry for what. Then usually last time we treat every day about 20 to 30 patients. Then study from that moment, 27 or 28 that time, November, every day is queue out is more than 300 people.
What? Oh my God.
So I say, wow, 300 people, I never
cannot rest.
Life. And not rest. So from the moment I still remember, wow, from 12 o'clock open shop treatment until 4 o'clock in the morning. So they are queue up, giving a number, give it maximum is 100. Oh, I come very far from Kedah or what? From Kelantan very far. Give already what 300. Then continue for 4 days. I work until 12 to until 4 o'clock in the morning. Then go back and rest. Then 8 o'clock, a lot of people queuing up already.
Oh,
then from that moment, then my friend tell me, hey, don't worry, Chris, don't worry. This is just a moment only. After 2 or 3 months, I'm back to normal one. 2 or 3 months back to normal means my I cannot jackpot only. Jackpot, After that, back to normal means my skill no good. From that moment is thank you for this. My good friend tell me these things, and I have to maintain my standard.
So how many patients do you handle a day now?
Last time I can handle about 300 patients a day. Really, really tired. Then after that, because of the incident, they are queuing up and got a little bit fight outside. So from that moment, I don't want to do any treatment in Malaysia. Then I go around the world. So Malaysia people cannot find me because I don't want to queue up. I also cannot allow them.
Yeah.
Then after that, I train a lot of and practice over here. Then after that, now I treat not that much. Before the COVID-19, I treat about 100. Now after COVID-19, I do about 10 case a day only.
All right.
Okay.
Mm-hmm.
All right. But
so at least got what I call my apprentice can hands on. Let them hand on because the best teacher is not me, The best teacher is the patient. The patient always, whether you're good or not good, the patient always give you a correct feedback. So from there, get more knowledge. Like my mom, my dad teach me how to teach me. Do practice, make perfect.
Okay. In your many years in this practice, has there been a case where you cannot help treat any kinds of aches or pains?
For me, because I'm specialized on bone, because I'm specialized on bone manipulation, and a lot of people like example, I in Sabah that time. So usually I do a booking, everything they queue up is a bone. Then after some of the family member bring the like CP, cerebral palsy means the brain
palsy,
damage. So it's a brain damage during a young age or born unmatured. So you come over here. Actually we don't treat this kind of sickness. So after that, I come very far from 4 hours drive, come to Sabah, look for me. So I say, oh my God. So what come all the way already. So I said, never mind, let me do something for the wonderful child. Now after that, from the child cannot move, very stiff on the hand and leg and very stiff. So what I did, I said, I cannot promise after he can walk. They said, no, Master Chris, I don't want can walk. At least I can see he's more flexible and not too tense or what. So after that, within 1 section, you can see his improvement on the flexibility. But of course, I'm very sad because I cannot treat back to 100%.
Yeah.
So I cannot treat like what I call like a CP patient, and then a stroke patient, because a stroke patient is due to the nerve, and also for my what I call cancer patients.
All right. But I don't
And a lot of
understand
people
about
say,
I don't understand about how the broken bones. How do you fix broken bones? You know, usually you have to have a cast and this and that, whatever, you know?
Yeah. So actually, because last time my mom staying in Kepong. Kepong very near to Jinjiang. So the Jinjiang last time our area is a lot of gangster. So usually, I still remember every time about 2 or 3 o'clock, ding dong, ding dong, ding dong, ding dong, 2 o'clock in the 3 o'clock in the morning, like ding dong, ayo, my friend, ayo, wow, 1 car or 2 car come, wow, just only 1 patient, wow, broken, and then say means here it broken on the what I call the raised part or the what I call the ribs part. So after I got X-ray, you see, doctor, you can see, can you help my friend? Broken here. So what we do, usually for the Western, they are using like operation, put a metal plate, or either putting the cement or cast on the hand for 1 whole month. But before last, for our tradition, we are using the bamboo. So whatever alignment, they are putting 2 or 4 bamboo to straighten back.
Right. Okay.
And one thing good about bamboo, whatever you got a fracture, definitely you can see your hand like a blue black, all the bruise come out because all the blood cannot come out from inside. One thing is about good bamboo is a line he will absorb the swollen because he absorb because of bamboo. They have what I call the ventilation.
Yeah.
So absorb especially for the blue black or what very fast or inflammation very fast. So from that moment, then you align back, then you check back the movement. Then about 3 weeks to 1 month time, then you can see back all the mechanism movement joint.
Actually, I'm quite curious as to how when you manipulate someone's bone, right? How does it help them heal? Like, are all these illnesses or pains or aches caused by your bones not being aligned?
Yeah. Example, like one building, like what I call like KLCC. The most important for the KLCC is called foundation. And the foundation then can build up like more about 100 story or what. So for the human, one bone, what I call one joint section, only one joint, of course, the bone. They have a muscle, tendon, ligament, and also the what I call the nerve inside is a one category. A lot of people, because of due to the misalignment or spring or jerk or twisted on the joint position, then after that we call it imbalanced muscle, and then the tendon also one long and one short, and what I thought the cartilage is uneven and even entrap the nerve. So if you do like other like acupuncture or what, then you can see effective for 1 or 2 days. Then after that come back because of it's not said not effective, the effective, but the most important, you have to align back the bone position to the correct position. Then you can feel release, and the mobility of the movement is back to the angle that you want. Then after that, he will feel back the cartilage, tendon, and balance back, reset back the muscle. Then the nerve is the last one. So it's the most important, like the car. The most important car is very easy. Off track is called balancing. If let's say the car, the balancing no good, you go about 60 or 80 km/h, then the whole car is wobbling. If you align back the 4 tires, you can go for 140 to 160. It's still very smooth, same like human body. So human body have to see from the ear, shoulder, elbow, hips, knee, and ankle must be in the one line. But now you see everyone is like in and out. Then affect like lower back pain. Lower back will affect the knee. Lower back pain will affect the neck. The neck will affect the knee. The knee will affect ankle because of the foundation offset.
Okay, now I understand. But from what you're explaining also, it sounds a little bit like chiropractor, what a chiropractor does as well, right?
Yeah. And a lot of people ask, hey Chris, I want to ask you, Tita and the chiropractor, what different? Actually, asking like karate and taekwondo. Is what different? I said, same lah. Both also using the hand, both also using the two leg and kick and punch only. But it's only different methods. It's a different method. And then chiropractors, of course, they are what I call developed and specialized on spine. But the Theta is more than the 2000s during the Three Kingdoms that time. So they have the different method on it, but the manipulation, the most important, the manipulation, they have the different skill. And the vision is to make a line back to the patient, less painful, disappeared, and align back the posture on.
Do you do spine as well, or like if someone
yes.
broke their spine, you can't fix that, right?
Usually what we cannot do is if let's say you got dislocation or what, then we can do it. Especially everything is during the bone we can do. Only the bone, like a car accident, sometimes like like collarbone accident, and then poke up, got blood come out already. So got blood, what can we do? Because our thing is not that hygienic. You have to go to hospitals and
sew it
handle
back
the wounds first. Yeah, sew it backward. Then after that 1 or 2 months, then we can handle back. But we got to see any blood we can't do.
Okay. Now,
so one thing good is about the doctor. One thing they're hygienic, they have a sew back of it. But us is more on the manipulation. That's all.
Yeah. So in your opinion, someone has to believe never mind. We will get to that question later. But sometimes when I see your videos, right, your viral videos of you cracking someone and all that, the sound of the bone cracking, right, under your hands, it can be slightly scary. I mean, satisfying, but slightly scary. But in the beginning, when you started your practice, were you ever worried that you might actually accidentally like crack someone's bones or tendons or
make
hit
it
a
worse?
nerve? Yeah.
I also asking my dad and my mom this question. Hey, Mom, why got sound clock? Is this broken or what? Then my father tell me, don't worry, whatever you hear all this big pop sound, it's not you're not breaking the bones. It's open up the bubbles. So because all the bone between the bone they have a bubbles. So release the bubble and then easy to ventilation back and more movement.
Oh, it's when you crack your knuckles and everything.
Yeah, especially the knuckle. After you already 5 minutes later, you got like
yeah.
Hear the sound clock. This is all bubble.
Oh, there it is.
So wow, expert. Even you lift up your hand like this also got sound. Wow, yeah. So they have a few type of sound. Like this is called a bubble sound. Quick drop. Another type of sound is called shrub, like a jelly, especially on the knee. If whatever you hear the sound like shrub, like old lady after squat down cannot up. This crop got a jelly sound is mean the gel no more, no good. If you got the sound of pick pop, it's a bubble on the between the joint open up. Another one is got injury. Let's say this is really got a lower back problem, sleep disc or what. Then you hear the sound is different. The sound is pop. It's like a pooping sound, very loud, pop pop. Or the neck of the sleep neck or neck problem. Then you hear the sound is pop pop, very sharp sound. That one is called misalignment of the joint.
We gotta check you, Bel. See what sound you make.
I know, because like I've been having neck ache every time I wake up, neck ache, and then make me have a really bad headache.
Yeah, usually because the neck will affect like a headache and not enough blood circulation to your brain. Usually we call it on C3 until the C5 this section. Many people even now last time you thought migraine, headache, or stroke after 30, 40 years old. God, no, now I tell you 10 years old to 12 years old got migraine, and 10 years old to 12 years old got stroke patient. So now it's due to the what I call the lifestyle difference.
But is all of this backed by science? Has science backed the studies of bone setting?
We can say what I call the study. You can qualify to understand more of the internal, because some of part, like example, neck is a very fragile part and also very handled with care. So we have to go more on the education to learn all this. Of course, what I call from a generation passed on is the knowledge and the secret of the what I call the arts.
Okay. Now, tell us about some of your more memorable success stories of patients that you've helped healed throughout the years in your practice.
Wow, got a few. I still remember about 2 years back, got one kid from Thailand. The kid's about 13, 14 years old. I think it's quite viral, that video. And the kids come over here, their mother all the way from Thailand bring over here. And where are you from? Oh, I'm from Thailand. What's wrong with your kid? Oh, my kids got a car, got a car accident. Her mom driving and missed up the speed bump and crossed. And the kid sitting behind without a safety belt. Because of speed bump too high, Kong. Then the kid hit on the
roof
and bounce back. found eat and bounce like this only. Just very pop up. Then after that, you go for a lot of specialists here. Cannot walk. The kids cannot walk. Cannot hold anything. Whatever you touch on the hand will shake and throw. Put all the paper on it, the hand will shake and throw. And also, whatever cannot walk, you have using a wheelchair and suffer for about 4 months to 5 months time. After that, hear my name. He said, my son got a little bit problem. He didn't tell me exactly. So after come here, I see, wow, amazing. This one I never seen before. Put everything on the hand. Then the kids shake and throw. Put everything shake and throw.
So he cannot grab, is it? He cannot
grab and cannot hold or anything on the hand. Even holding a pen also cannot. Eat also cannot. So I said, oh my God, I never seen this case before. Then, Sifu, can you help? I said, I do my best. I try my best. So from that moment, then I scan back whatever the knowledge my mom passed it to me, back to the basic. Whatever you can see, all this problem is due to the neck or lower back. So the neck will affect the both hand and the head. So after that, I do an alignment on the neck. After do the first treatment already, then the kids can hold things without shaking and throw. Then after that, wow, go back. After 3 months, wow, can do everything. Then come back again for the second treatment. He said now the walk not so move. Whatever walk, I have to touch something. Touch. Then cannot walk too far, about 10 meters. Then you have to sit down. So after that, then come for second time. Then I concentrate because lower back is affect the both leg. So I do a manipulation on the lower back on the L4, L5, S1. Pluck. Now after that 2 months, now become a friend. So I say, you want to come to Thailand? I got all the family, all my friends want to look for you. So that this case, I say is a very unusual, but always back to the basic and do and then can see the result. And the mother and the kids also very happy. Yeah, 3 months, wow, so good. You're helping my whole family. So every time like Father Days, Mother Days, or Christmas, always the kids write something. You are my hero, or what. So make me very powerful and make me. It's a very meaningful job or contribute back or to this society.
So this boy is perfectly fine now. He can walk.
Yeah, fine. Last 3 weeks, about a month, he sent me a video. Like to send me a video and a video. He racing, running with the fence until because it's running so fast, until the fence come down. so it's so cute, and very supportive and very appreciation from this kid. Wonderful.
Okay. When people come in with an injury, right? How many sessions would you recommend them to do for them to be good again?
All right. Usually for the Theta, we have we call it a follow-up section. Usually about we call it a one course, about 4 to 6 times the cost. So because then after that, a lot of people say, hey, Chris Leong, I suddenly become famous. He said, one time can cure one time can cure all the patients. I said, I didn't say. A lot of people say I'm one time because why? I always travel all around the world. So I travel around the world. I only one opportunity and one chance only. One chance and one opportunity. I cannot come and stay for 1 week and do one patient. So that time, I still remember like US, whatever I do, I still remember, I go there, oh my God. At home, I ask the patient I have to come back alternative for 4 or 6 times. But in the US, I didn't have much time. I have to travel. So I say, you just come for one time. I manipulate like all these frozen shoulder or what. Clock, then the person can lift up, eat back to normal, no pain. Then I say, okay already. Okay, the definition means okay, means the position back to normal. I only can help you 70%. And the 30% you have to help yourself, means that your lifestyle, your diet, and your posture must be right. Then after 2 weeks, should be okay. So I only do one time. But from that moment, because of one chance and one opportunity, I do a lot of people, wow, one time better. That's why a lot of people say, I'm one time, it's cure the problem. Actually, no. There are few still a little bit, but have to physio back a little bit and handle with care of their sickness.
Okay.
But,
so normally it will be about 4 to 5 sessions.
Yes, but now I have to more concentration, whatever knowledge I do one time to perfect first. Perfect first, then you can see. That's why you can see all my video before and after. Because
immediate,
I always
right? It's like immediate.
Yeah, I like to apply the we call FAE, fast, accurate, and efficient. Fast, diagnose, accurate to the point, and the efficient on the movement. So and then, but a lot of people say, but this video is not what. But for me, doesn't matter. The most important, the patient. Now this moment and this time, the patient feel great. Wow, good. Can last or not depends on lifestyle on it. So if you're what I call changing your lifestyle a little bit and handle with care, should be no problem at all. So I got a lot of patients come back and say, hey, last time 2 years like yesterday, I 2 years I got an injury. I go for your world tour and you fix one time, okay already. So today you come, no, I do another part, my another hand. So wow, last time I go for what? You only want treatment. Wow, fantastic. No more pain until now. So no, this is the same part. No, another hand. So yeah, so sorry because of a feedback. The law said did a very good job.
I was wondering about that because you said lifestyle, right? Let's say for Bel and me, because we work in front of the computer so much, we have neck pain, back pain, everything. After that, we go see you, then we fix lah, right? After that, wow, we feel so good, and then we go back to work, and then after that, we can do this again. We'll have to see you all the time, right?
Usually like your profession, because I can from here, from this I can see your angle, your shoulder, and also the shoulder, and also your head posture. After a line, definitely about 2 or 3 months, you will come back again. Then you come for maintenance. But after you get my treatment, we'll teach you some technique or sitting position, or some what I call DIY, or also what I call the rules of the computer. We call it like 20-20-22. Huh? What is the trend? What's the meaning called 20-20-22? So 20 especially for a lot of people got a smartphone, computer like your in a DJ or have to do a lot of computer. 20-20-22 is called 20 is the inch from the monitor size inch. Minimum have to bigger than 20 inch. Cannot very small. If it's small, your head will protrude in front and your neck slowly become tilted.
Okay.
Then another called 20 is the eye level to the screen is about 20 inch away. And the next one called 20, every 20 minutes, after that, yeah, like this, after every 20 minutes, done already, you have to rotate your head left and right. No need to stand up or rest.
I do that a lot because it's so uncomfortable. I have to do that. Yeah. Right.
Yeah.
And then you hear crack. Like
exactly. So 20, after that, you left and right to ventilation back the muscles and also ventilation back the blood pressure on the neck, on the spine. And then the last one is called 2. Every 2 hours, you have to stand up and give yourself a break for 5 minutes. So this one is called prevention. But a lot of people, one shot, especially accountant or what, they have a season come,
Yeah.
So after that, they are from morning 10 until 10, they are skip the lunch or what, skip or the whole day in the computer. So it's a call quite serious on the what I call the lifestyle injury.
Yeah.
Also,
they have a few type of injury.
Yeah.
We call it lifestyle injury, or we call it a domestic injury or sport injury. So the domestic injury like housework, cooking, this one, take care of baby, and also the sport injury, especially sport injury, quite a normal sport injury is a golfer. Because why? Golfer always got a neck pain and lower back pain and elbow. It's due to, I don't know, golf always swing about 100 balls or variation. Shoot only left to right. But I never see from left to right. From right to left. Yeah. So after that, you create what? Imbalance muscle in the right. That's why you can touch. You touch the patient on the right side of the muscle very hard muscle on the very great muscle on the right side, but the left side very soft one. So whatever got the imbalance muscle, the whole spine will slightly tilt will affect the neck.
I find that because I play tennis, my right arm is more muscular than my left arm one. It's very funny.
Definitely.
Yeah. Hey, I need to go see you. I need to fix a lot of things like a problem.
Come let me torture you one time, then you understand.
Is it painful, Master Chris, when you do your bone manipulation? Because I'm scared. Like I'm a bit scared when I hear the sound. I'm like, is it painful?
I'm not scared about you. I'm not scared you about pain. I scared you are addicted. Oh my God, this is what I want. Very nice. Wow, I hear the sound. Pro. Wow, I can feel the release from the there are a lot of what I call the patient the feeling what wow after you do treatment I can feel like I get very very full, the whole body very what after drinking like Coca-Cola or Eno, the air open up. Wow, the feeling exactly same. Whatever you crack, after I can feel my blood from my whole body, it's like release, you know.
Walao.
So wow, they all explain. I also want to try. Actually, as a lot of people say, hey, is it scary or very scary or painful or not? Maybe about 4 years back, quite a number of people like a bit worried and scared. But slowly, I go everywhere and then I go like shopping mall or in immigration or police officer. They ask me, hey, I got this pain. They are also scared and worried. But the most important must be very fast and accurate, and have to follow their breathing. So if the person very tense, you don't try to crack first.
Right,
That's why very easy to injure the nerve and the muscle. So you have to make a fun with them. Hi, how are you? Where are you staying? And then you take a breakfast, what you eat, then pop, straight away. Because why? In a minute of second, very short time of period of time, he released and forgot. He think the muscle and the nerve not controlling the whole body, then you crack, then no pain at all. Actually, you're cracking, you can see all my video, is a pain? No, but they already enjoy. Then now, or even what I call, now they accepted, a lot of people accepted do the cracking, especially neck. Hey, neck don't simply let people try. But after that, see, hey, Chris, they say this Chris are very, very fast and accurate. Pop, after that, the problem gone already. Like
Actually,
last time I do the frozen shoulder. Frozen shoulder means the shoulder cannot lift up. Last time I have to do the shoulder, then you can release. Now, until that level, I don't need to do any shoulder, just only the neck, crack, the shoulder can lift up already. It's connected.
How often can we do, let's say, like Bel and me, we have neck ache and everything. How often can we come and see you about it?
Usually for normal people, we can 1 month can come twice.
Oh, okay.
Let's say no problem, we call it alignment. About 1 month, twice a month.
Okay.
It's the best. If you got a serious, we call it alternative day. Let's say like dislocation or fracture on the hips or femur head or what. So you have to alternative for the 6th time.
Because I think I might get addicted to it, you know?
Yes, please come.
But Master Chris, right? Like you said earlier, this person will have to be relaxed when you do the bone setting for them, right?
Yeah.
But do they have to believe in the healing process? Then only you'll be able to heal? Have you ever like converted someone who was initially skeptical about it? Like, I don't think it will work lah, you know, and then he said, okay lah, you just do lah. I don't think it will work, you know?
Yeah. Usually for last time, quite difficult. I still remember when I viral at the time, then I do this, what I call, actually I do Facebook, it's not marketing, but because I like to take picture and keep, so that this video, whatever I recorded, everything, because my father gave me one secret book of the Tita. I don't understand. He's drawing like this, like this, all like this. I understand. The book understand me, but I don't understand what he's saying.
Oh, it's so okay. It's a learning tool in a way.
Learning tools. Then after that, I also got this skill. My drawing not so good. My writing also not that good. So how can I pass the knowledge to my next generation? That's why I do a shoulder on the video and keep it in the Facebook to share it to my own family member, my friends only. So like this. So there are only frozen shoulder. There are so many cases. Then you can get a reference from there. Then a lot of people see, wow, this guy, Chris Leong, like everything teaching one, explain everything in a video. Actually, my intention is not to everyone know, to pass it to my twins or my son. So they'll see, then slowly they share out. And within a very short period of time, like 2017 until 2020, about 3 years, about 4 million followers to support my platform.
Wow.
So usually for this moment to keep the what, and then just now you asked me what question
about
because you know how some people they have to they have to believe Chinese medicine, then they eat it, then only they will get better, right? But have you ever healed someone who like said that your skill will not work on my problem?
Yeah, that's why I said because of this Facebook now linking back. Then after that, I got a viral. Then Hong Kong, you know, some people like think comment, Yahweh got the amazing one time like this, let that 30 second. Then all the doctor, no work like this. I don't care. I just do my best on it. Then after 3, and then this one must be pay money and show off on it. Then after that, another comment right in, wow, he's very rich, you know. From morning 12, I see it's live until 4 o'clock. And then the kids are the 3 years old and the grandmother, very good acting. So actually from this moment, then slowly people, they change their mindset. A lot of people don't believe and very skeptical of this one. But actually a lot of people, they are complaining, actually they have no problem. There are no problem, no injury. That's why, like this. But a lot of people got a problem. They suffer for more than 3 years or 10 years or 20 years. Why not come and try? So whatever they try, they understand, oh yeah, it's really work. So that moment, whatever you do your best, the most important, the patient, they feel the difference. Then Then after that, all the patient come over here and slowly see my video. And what the amazing, because of this video, they see my face and, oh, Master Chris invited me. After that, you feel better already. Actually, because of the every day you doing same thing again, the patient from the trust and the patient from all the video, the information, they are before I treat and after treat, they are about 50 to 60 improvement by the trust on me. So I will say, yes, the trust is very important.
Yeah.
And also your skill also lah.
True.
Actually, Master Chris, you do bone manipulation and give so many people so much relief, right? Do you get Theta by other people? How does it work?
Of course, for me, because I treat a lot of apprentices, sometimes, I got my neck a little bit uncomfortable. So I simply choose this one. Okay, like today your exam.
Test. It's a test time.
Test or exam. Okay, now exam time.
Oh my God.
Okay, that's okay. So whatever they'll do on me, actually is called both side learning. They'll do one side is wow, this is correct. Another side, they don't know how to use the strength. We call it a 6:30. So one side is good, another side not good. So at the same time, I can feel the improvement. At the same time, he also learn. So then slowly to fine tune them. So for me, I got about 100 apprentices already. So every day I got a new, new apprentice to do for me. So for me, I got no need to DIY myself. I got a lot of students to help me back.
Now, Master Chris,
yes.
I guess Theta, this is considered like alternative or complementary medicine.
That's right. Exactly.
But what would you say to people who only believe in like one form of medicine? Let's say they only believe in Chinese medicine and they won't even go see a Western doctor, even if they have a terminal illness like cancer or whatever. Like, how would you advise these people to incorporate these alternative or complementary medicine, like your bone setting, into their lives so that they can feel better?
Yeah, usually I cannot say it's only you have to go for TCM to cure your cancer or what. You have to listen for both advice from the Western and the Chinese or alternative. You have to search around and you try around. The most important, you have to see the improvement. Whatever you got, let's say you go for the TCM, maybe they're taking the herbs or what. Some people, they cannot take too much of a consumption of the what I call hitty, we call it hitty herbs, whatever this is for, reaction is different. So if you feel comfortable or you can feel improvement, then you continue. And you're not comfortable, then you go with Western. That's why I can say the alternative, we are not saying we are the best. I always say we are alternative treatment. So whatever you feel very uncomfortable, you have to go back to the hospital or go for a specialist and check it out. So actually I would say we combine the Western and the Eastern, combine, get it from the what I call the best of the idea and make it like me. A lot like hey, Master, after manipulation, do you give any herbs or drugs? I said no. But the day before I come here, I see a Western. He still got a tablet for me, like a muscle relaxation and everything. I said yeah, continue. You just continue whatever the doctor prescribed to you. You continue antibiotic everything follow the instruction. What we do is just a manipulation. Then a lot of patient, let's say they are not taking a medicine and taking medicine, same issue, and the taking medicine one with the manipulation really combine, and the healing process is more faster than only the manipulation without other medication. So I would say combine is more efficient and more faster and healing 100% easily.
All right. Thank you so much, Master Chris. We
Thank
will
you so
definitely
much.
go and see you one of these days. I remember actually seeing you at Astro. I think it was early this year. You actually came to Astro, and then
Yeah.
you were helping a lot of the DJs do
Yeah.
their cracking also. Yeah, but I missed it.
Yeah.
I
Don't
missed it.
worry. Maybe when free or what, more easier, the number not so high already. Maybe I can go there and do some what I call charity work and help out all the very important people here and
Yeah.
give us what I call all the nice songs and nice what I call sharing.
Okay.
I like to do that. Or you are not you are busy, you can come to our center also.
Can.
Okay.
No,
You got
All
one
my
right.
shot
number,
do
you
all of us, and then suddenly you
uh-huh.
see, well, how come all the DJs are on Astro like suddenly so happy and chirpy, and because all saw Master Chris Leong already?